Kenya's unpaid care work, largely carried out by women, is finally gaining national policy attention. The proposed national policy on care, now awaiting cabinet approval, could transform how the country values and supports millions of caregivers whose work has long gone unrecognized. Every day, millions of Kenyans, most of them women, rise before dawn to cook, clean, and care for children, the elderly, and the sick. Despite this vital role, this work remains invisible in economic statistics. Studies shows that unpaid care contributes about 7% of Kenya's GDP, yet it is not formally recognized. The national proposed policy aims to change that by integrating care into national and county development plans and budgets. Drafted with input from over 200 stakeholders, it seeks to unlock opportunities in Kenya's growing care economy.
Kwa sababu ya Adasa, hakuna kazi anaweza fanya. Hawezi jisaidia yeye mwenyewe. Lazima mimi ndio niwe karibu kwa kumsaidia. Hiyo imenizuia kuenda hata safari. Siwezi enda safari ya mbali ya kulala. Sababu nikienda kulala kula usiku, hii ugonjwa inakujanga sana usiku. Nikienda safari nimwache hapa peke yake, ujui nini itafanyika usiku. Ni mali niko na wasiwasi. Sita concentrate. Sababu hali yake si ile ya ni kitu inakuja tu kighafla. So sijaweza kusafiri hata kwenda masafari mbalimbali kufanya biashara zangu. Naweza mwacha asubuhi nikienda, siwezi toka hapa asubuhi kabla hajaamka. Nijue ameamka aje, amechukua madawa zake, amekunywa uji. Siwezi toka kabla, na hata nikitoka sitafanya hiyo biashara na amani. Sababu wasiwasi iko kwake, ako vipi.
Grace Akinyi and her husband Peter Ahago have spent 8 years caring for their daughter Hadassa, who lives with sickle cell anemia and the effects of a stroke. Their story mirrors that of many Kenyan families navigating care without structured support.
Huwezi kosa kwenda kazi mara 3. Ukienda ukosa, ukiomba ruhusa leo, utapewa nafasi na mwajiri. Lakini ukisema kesho tena mtoto tutakupatia, lakini hiyo mazoea itabidi sasa uwezi ukavumuliwa hata kazi. So kazini unakuta ya kwamba itabidi sasa uache kazi, utafuta ile kazi yenye unaweza pata nafasi wakati wowote mtoto anahitaji attention wako kama mzazi.
The policy highlights that women shoulder the bulk of unpaid care work. A 2021 Kenya National Bureau of Statistics survey shows women spend 5 times more hours than men on domestic and care duties.
Also infrastructure, making sure that we have the right infrastructure, that we have, if I have a relative who has ill health for a long time, that there are facilities that are able to take care of this person with ill health. That if I have a child who has a disability, that somehow government is able to support me to take care of this child. That if we have, young children, that there would be ECDs, facilities that will enable me to take my children to these facilities as I go to work. So we are confident and we are playing our role to make sure that there is as much awareness as possible in terms of the impact. And I think the Kenya National Bureau of Statistics is also working out a calculation around if we were to bridge the unpaid care within Kenya, how it would translate into money, okay? How it would impact the economy of this country. And so if we have that figure, it's not yet out, but if we have that figure, it will be a driver, an impetus for the government of Kenya to then proceed and embrace it.
At the country's level, regions such as Kitui, Laikipia, and West Pokot are already seeking change. Women have successfully lobbied for new health facilities, reducing travel time for care, while men were increasingly sharing domestic duties, according to the UN Women.
The system is already skewed. Most of the work that the men do is work that finds itself counted to the GDP. For sure, when they go out to work, they're paid a salary, it is counted to the GDP. The point we are making is that there's quite a bit of work that women do that is not counted. Yeah? So we are just saying, let also count this work that they do. let it also contribute to the GDP. Yeah, I mean, I think the facts show, the evidence is there to show that there's a lot of work that women do that is not counted to GDP.
The private sector is also stepping up. More companies are signing on to the women's empowerment principle and introducing family-friendly policies such as lactation rooms and extended maternal leave. Crispin Afifu, Senior Gender Specialist at International Care for Research on Women, ICRW, says this momentum is encouraging.
Kenya is also having, in as much as we're a young population, we're having what we call an aging society. 9.8% of Kenyans are actually old men and women. These old men and women, they actually need care at home, in respite facilities, and even in whichever places where they shall be. That care has to be given by someone. So most of the time, if you look at the design of our social protection mechanisms, for example, cash transfer, it's only for for example, the older men and women, but not the person who's taking care of them. And so what the policy is recognizing is what we call cash for care. That when the government is sending out money for the older persons or a PWD, then the one who's providing care also needs to be taken care of, because that is their work. Some people need 24-hour care, so you cannot do anything else other than caring for that person.
Once approved, the policy is expected to spur job creation, improve social protection, and formally recognize unpaid care as a key driver of Kenya's economy. As the country pushes toward equality and inclusive, the national policy on care could finally bring visibility, dignity, and the invisible labor that sustains families and communities. Zainab Said, The Eastleigh Voice.